Hey beauties, welcome back. It is the final episode of season 3 of Aesthetic Chat with Kiki. First, I just want to say thank you all for those who continue to listen. I feel like I totally dropped the ball on season 3. A lot has happened in the last 6 months, and going forward in 2024 and with season 4, I promise to be better. Next season, I will batch release the season. So half of the episodes will go out one month. The following month, the other half of the episodes are going to go out. And next season, we'll be focusing a lot more on what's taking up majority of my life right now, which is the business and nurse practitioner school. So again, thank you all for continuing to listen along. This episode with Ina, it is amazing. You will notice, though, that it was recorded almost a year ago. And so I think it's still really valuable. Ina has such great pearls to share with you all. But just keep in mind that, again, it was almost a year ago that we recorded this. So enjoy. I want you to share your story into the aesthetic industry, and then we can kind of run through some of my questions that I have for you.
Okay. Well, thank you so much for having me. It was a pleasure to be on your podcast. I think that's amazing what you do, because you actually help other aesthetic providers to kind of pave its way into aesthetics, and hopefully they can learn from my mistakes. But my story is not that excited how I started. I just happened to be in the right place in the right time. It started 23 years ago. I was hired to work in dermatology office. So I'm originally from Ukraine. I did my nursing school in Ukraine. I graduated in 93. I worked in ICU. I worked in the summer with Doctor Without Borders. And then I actually had a position to work for a US-based government company who was disarming missiles. In order for me to work for them, I had to have a US license. And in late 19s, you had to physically be in the United States. Like now you can take NCLEX anywhere in the world, but at that time you had to be physically here to take the test. So that's what brought me to United States, but I never really had intention to stay. But to make the long story short, when I ended up staying, I came in to work into dermatology office, and my understanding of dermatologists was like acne patients and skin cancer. But he was incredibly progressive dermatologist who helped to develop lasers. So I came in the office and we had 15 different lasers, and we were doing study for Botox and fillers. And I was just like, what's Botox? So that's how I was introduced to aesthetics. And then it just kind of spiraled from there. But I was incredibly lucky because, again, it's just, I happened to be in the right place in the right time.
Very cool. When you came to the U.S., did you have to retake like the state nursing school and everything, or were you able to just take your licensure exam?
Well, I did have to take some of the classes because pharmacology was very different than what I used to in Europe. But also I've taken a lot of like psychiatry-based classes. We don't have that many diseases. So I studied probably 10 hours a day for 3 months.
Oh my goodness.
At the University of Utah Medical Library. And for me, what was hard is just how you guys take tests. That's not how our educational system works. Like we didn't have, when I was taking my nursing test every year, we didn't have a multiple choices question. That's not how our education was set up. So that was a little hard to grasp that perception. But yeah, I studied for 3 months and then I took a test and my computer shut down really fast. So I thought I failed it, but I actually passed it.
Oh my goodness. So over in Ukraine, were questions just like free response, like you have to actually write something in?
So say like if we're taking pediatric cardiology, you would study that subject and then you would come into a classroom where it's very old school, where you would have six professors sitting there from different classes, but they all had something to do with that particular subject, like some of the on physiology, on anatomy, some of the pharmaceutical. And you would literally pick up, you would see like this little piece of paper laying in front on the table. You pick that up and it would have three different questions. One was like a theoretical, one was like a drill question. So it gives you like a lifetime scenario. Third one was usually medication related. And you would have 20 minutes to prepare, and then you would get up in front of all of the professors and you would answer your questions. But what hard part is they could all ask you any question that is not related to the subject that you happen to pick up.
Oh, how interesting.
Graded. Yeah.
I think that's honestly probably a better way of learning. Like that, it just seems more simulation based and seems more real life. I think that that's much more applicable than taking NCLEX and, learning how to take that specific test, because half of the questions are literally used to confuse you or make you question.
It's funny that you say that, because when I was taking NCLEX, I was like, this is not it. This is not it. This must be it.
Yeah, the whole test is meant to trick you, and you have to learn to take that specific test. So I think that's very, very interesting. So in terms of aesthetics, it sounds like you kind of went the dermatology route, and it, like you had said, it kind of landed in your lap. So when you had started out there, were you mainly running a lot of the lasers?
We did both. So we were a huge research facility. So we did any new device would come in on the market, maybe not every, but a lot of the devices that would come in on the market, we would do FDA study for FDA with IRB protocols. We also were doing the same study for neurotoxins and dermal fillers. And I was continued doing those till 2 years ago. So we had lasers. We ran, there was just a medical dermatologist, very small part of it was a medical dermatology. We were all cash-based paying business. And it was 23 years ago, believe it or not, we would go with my dermatologist to University of Utah grand rounds for dermatologists. And people looked down on us like we were not even in medicine. Like people was like, you went to cosmetics? That's not real medicine. And then 5 years later, residents and fellow were rotating in our office, and they thought that was the best things that ever happened. So it was very interesting to see how perception about aesthetic changes, as well as recognition, if I may say.
Mm-hmm. Very interesting. I bet that was super intriguing. How was being a part of those FDA approval studies and really on that very emerging science? I think that's not all injectors have that opportunity to be a part of that.
No, and I have a very analytic mind. Like it needs to make sense to me. So that's why I love lasers, because they're so physics based. And if you can understand how every device works, like how specific lasers works, you can literally get any machine, look at the parameters, see how you can adjust things and be able to run it. It's absolutely amazing how you can predict what the skin would do, or based on the response of the skin, how you can adjust your parameters. The same thing went for studies, because you need to understand the basic principles. And because we were in the very, very beginning of aesthetics, we were the people, the group who helped to develop protocol, helped to parameters, or how you develop certain, like how do you read the study? What is a grade that you're grading the patients? It's something that I was super excited every single morning to go to work for, because it was never boring, and there was always something new coming out. I was attending different congresses in Europe that now are becoming extremely popular, 20 years later, but and they're like 22nd Congress. I remember being at that conference when it was like their second meeting, not a 22nd.
How cool. So my question for you is, I know that you fairly recently, made that leap and left a practice that you were with for 20 plus years and then started your own. So how did you go about making that decision and kind of how is it going?
It's going amazing, but if you were to ask me 2 years ago, I never planned on having my own practice. I actually loved the environment because we would train fellows, we would train residents. I had such an amazing relationship. We also had a plastic surgeon who had an OR, so I can literally walk into OR and watch facelift. Because let me tell you, the cadaver dissection is nothing like a live person.
Right.
How mass looks like, how muscle looks like, how vessel looks like. So I absolutely love the environment I used to be in. But then our office got doctor who I worked for, he is getting ready to retire. So that was his exit plan, which we all should have, right? At some point. So our practice got sold to private equity. And as they came into the office, things changed, not in a way that aligns with my principle of how I build relationship, because my patients, I have patients who would come in and say, you know what, I don't know if you remember, but first time I met you, I brought my granddaughter in a car seat because my babysitter canceled and now she's getting married. So I'm getting ready for the wedding and I booked her an appointment for lips. Like, I've had a relationship with patients for that long.
How cool though.
Yeah, but then when a big corporation comes in, I don't think they really realize that this is not like, you need time. Sometimes it may not be your most high paying patients, but you still have a relationship with them. You watch their kids grow and I want to have time to talk to them. I know how each of my patient needs in order for them to feel comfortable and to make a decision and not to feel pressured and do what's best for them. But just that culture did not align with my thinking. And that's why I kind of made a leap, because I really didn't, I would have loved to work. I have no problem working with another doctor or another office. But then my thought was, I happen to be in this particular situation after 22 years. And if I go work for someone else, who am I to say that it will not happen again?
Right.
I just not want to go that route.
Well, that's awesome. How has navigating like the business aspect of things?
I was lucky in the sense that, so I don't know if you know that, but I also been a training for Allergan for, I don't know, 15, 16 years. I kind of lost time. And in that period of time, like last year, I trained 127 offices.
Oh my goodness.
I developed such a close relationship with some of the most brilliant business people in the industry that became friends to me for over so many years. So when I finally was exercising the idea of opening the business, I literally could call someone and just say, what do you think? And they were able to provide me so much resources, so much like help as far as like what mistakes they made, what I should do, what I shouldn't do. Someone would, help me. What's the best way of doing, legal part of it, or how to register the business? What's the difference in the law? So I feel extremely lucky in that sense that I literally had everything, like some of the most, again, brilliant people like Vanessa Lee. I've trained her at some point of my life, like Erin Jensen, my really dear friend Kristen. She's in Florida and her husband is malpractice attorney. I was able to literally fly to her over the weekend, and she spent and her husband spent whole weekend just going over my consent forms and helping me word different things and showing me different systems. So I wouldn't say that I was lucky. I was just extremely lucky. I must have done something right in my life to have that resources and access. So it wasn't, I mean, it was, my brain was expanding, let's put it that way.
But that's amazing.
In a good way. And I did feel I opened a week a little bit earlier than I was planning. And I was lucky because my assistant, who's been with me for 17 years, came with me. And she knows how I think, how I talk. She can pretty much know what my next step is. And yeah, for the first week, it was kind of very interesting because we didn't know how to run a credit card, how to create an invoice, and my first patient of that we treated, she goes, "Okay, so I'm gonna pay some in cash and put the rest of it on the 3 different credit cards." And Katie goes, "Thank you for learning experience. I do not know how to do that." But we're gonna figure it out together. And now it's just this smooth sail that is, yeah, I mean, there's little things that we have, and you're trying to figure out which way to go. But I think for me also why it's not as overwhelming is because I'm a solo provider. My office is the space that when my patient comes in, it's me. Like my logo is me, my decor is me. Like it's just, and patient comes in and they literally like take a breath and they like, this is a different feeling and different aura, and we love being here. So, and again, I don't have to run other providers or think about someone else or think about how to fill their schedule. My schedule is full as I want it to be. And so that makes it easier. I don't have as much stress. And I'm not necessarily looking for building empire. I want to have my little boutique, very personal feeling space where everyone can be themselves and I can take care of them the way how I feel like I should be taking care of that patient.
Well, I love that. I'm so happy that everything's working out great for you. I think that it's great because you just describing your transition into owning your own space and kind of tackling kind of the unknown part for you, that's the perfect example of collaboration. The fact that you have built all these relationships to where you can consult all these people from around the country and they're willing to share what they know and help you, I think is really encouraging for me being only a couple years within the industry and to see that, it's not as competition as everyone's saying. Like we can all say collaboration over competition, community over competition, but what you described is the perfect example of what community is.
And it's not just people from out of town. It's actually people who are in Salt Lake City who, when they've heard, because, news travels really fast, especially like a practice like ours when it gets sold, because we had 39 exam rooms, we had 67 lasers. It was humongous, not even including our research part. So it was, the news kind of traveled. So people reached out to me asking me if I would want to come in and work in their office. And other people would literally reach out and say, if you need anything, let me know. I had a, who didn't know her as long. I've probably known Hillary for 3 years. She's been injecting maybe for 5. Like I've met her before, but for the last 3 years, I've trained her a couple times. We, bumped together. She literally came to my house at night to talk to my husband, to show the numbers, to ease up my mind.
Oh, that's amazing though. I think that says a lot about maybe your character and who you are as a person. So that's awesome.
Yeah, I've been very, very blessed. And I'm hoping, like, if anyone ever reaches out to me, I'm willing to tell everything that I know, from where to order cheaper needles to what documents you should be having or how you good faith exam should be done,
Yeah, that's amazing. So I do want to talk a little bit because nobody on that I've actually interviewed has really talked a lot about PDO threads. So a lot of the people that I've interviewed do not have a lot of experience with them or just really didn't necessarily have super positive things to say about threads, but I know that you do quite a bit of them. So I want you to kind of talk about your experience with them and just the results that you're getting, because I did do a little stalking on your Instagram and you do get some really great results with your threads.
So it started actually from my own vanity. One of my conferences in Malta, I came across a plastic surgeon from Ukraine. So we connected at the conference and we became good friends. She actually would come into Boston and she teaches at different universities. She's extremely talented, smart. I look up to her. And I was born with extremely stretchy skin. So my skin, I actually have a reel somewhere hidden that it says, I'm going to believe it. I could literally pull on my skin, on my neck, and it will pass my ears. Like I have.
Okay, you have like super hyperelasticity.
Yes. And I've tried being in office with all of the devices. I've tried every single thing. And it looked good, but it wasn't. I just knew that it's not something. I'm gonna be in trouble after 50.
Mm-hmm.
So when we met on some of the conferences and we were talking about it, because Europe is way ahead of us. So many different procedures they do, so many different, devices, different, even the amount of dermal filler. There's like 180 dermal filler versus here we have like what? So little.
Yeah.
We were talking and I told her about my stretchy skin and she said, have you ever considered to do PDO threads? And I said, no, but I've tried every single laser and radio frequency there's on the market. And she goes, just give it a chance. So I went back to Ukraine next year. I went into her clinic and she did my neck with the PDO threads.
Okay.
And it looked good at first, but I was just like, well, I can see the difference, but I just wasn't that impressed. And then a month later, it's very hard for me to describe that, but it literally was like a saran wrap. Like my neck just went and it looked perfect. And I was just like, wait, what was that miracle thing that I did? But the problem was they were not approved here yet. And as a training and research, we could bring that into our office. She was doing threads for 20 years prior. So she had a huge experience with BDO threads. But I talked to all our doctors and fellows, and she was teaching, I believe, in Miami. So we flew her in to our office, and she spent 2 days, 10 hours a day, teaching us on the PDO threads. A lot of them were her technique, or some of them were just not necessarily what you would see company teaching it here anymore. And it happened that in my office, two of our fellow who was at that time, they left. One actually went to work for Army Clinic and they weren't really doing PDO threads. And another person no one really took for it except me. Because I was so intrigued. And I have to tell you, it took me 5 months doing PDO threads every single day where I felt like, okay, I think I got it. And you probably, if you look at some of my early posting on Instagram, people would be like, isn't that the wrong way of putting PDO threads? And now everyone it's a reverse vector.
It's funny how far behind we are.
Yes, but I can tell you the reason why probably a lot of people don't have a lot to say about PDO threads, good things about it, is it's not like filler. It's not like anything. You have to have the same anatomy knowledge as you do with the filler, because you can give the same filler to two people and they're not going to give you the same results, because it has nothing to do with the product they're using. It's the placement, it's using of the ligament, it's a using of the dermis. It's actually figuring out the benefit versus risk. And there is some patient that I would do only certain threads, but won't do another one, because the chances of something not going the way how I was hoping for is greater than benefit that I can for sure provide it for them. And I think that part is missing a lot of times. And a lot of people here use lifting threads more because it's that repositioning of the tissue. But the problem is, if someone doesn't have a good quality of the skin, if they're not an ideal candidate for something, you will never going to be able to give them ideal outcomes. So I combine smooth threads in a weaving technique, and it catches the dermis, goes underneath the subcu, catches the subcu, catches the dermis, and then I anchor them in the fascia. But if you ever inject it in the dermis, it's really hard to even push the needle through the dermis. So if you truly get that tiny little thread into the dermis, it's going to stay. And then you're going to anchor it in the fascia. So you're doing almost like a mattress stitch, giving an instant lifting, but in the same time, you're not just affecting the skin, you're affecting a subcu. And the subcu in that weaving technique is better off kind of like congested or compressed, and you're getting more firmness than if you just take a blunt cannula and go through subcu, and those barbs may grab or may not. And that's why I'm getting as much of a good results. But my patient loves the threads. I have a patient who's been doing threads for 5, 6, 7, 8 years with me, and they coming back for it because they absolutely love it. But it's something that I could not achieve with any devices, because laser only goes through the skin. But if a subcu is, or superficial fat pad is loose, it's not gonna firm that up.
I think that's a great point. I think that you just saying that it took you 5 months of using threads every day in your practice to really feel like you semi-mastered it. And for you to you went out of the country, had training by someone who's been doing this 20 years. I think that a big part of it sounds like, is patient selection as well as your technique.
Oh, absolutely. Because you have to, I think like with any procedures, it's not just you look at the patient, you come up with the plan, and then you need to have an expectation. So I do mark patient for threads, but really placing my second thread with the vector will depend on what my first thread did. Do you know what I mean?
Right.
Like sometimes I have a grand plan, but if I put one thread how I was planning and it's not doing what I wanted to do, then put in 3 more threads is not going to really help me, or will only help me for a hot minute. So planning, then have an anticipation. And if it works, then I would continue with my plan. But if it doesn't, then I need to have enough knowledge to regroup and come up with a different plan that will give me the outcome I'm looking for.
So being a trainer, obviously Allergan doesn't have threads, but when people ask you this question, like, hey, should I bring threads on into my practice? Do you have that conversation of, it's going to take a lot of time, effort, work to really master these and kind of prepare them or warn them against potentially picking up a thread? Just because I think, if you go to these conferences, it's really easy to want to try to pick up everything and want to try to add these different modalities to your practice. But I mean, it's not something, it sounds like, that you can pick up right away.
Well, I think it's an amazing tool, but each tool has a lot of responsibility. I usually tell injectors or people who do threads, you need to know what to do if you get in trouble. Because my weaving technique, it looks so easy. And I actually had this when we would have residents come in and follow me, and they would watch me do it. And they're like, oh, this this is great. And one of our fellow actually said this sentence, and I'm like, okay. She goes, it may look easy, but just because you can drive doesn't mean you can back up a trailer into a right spot.
Great analogy.
Yeah, and she tried, and she's like, it looks easy, but it's not. You really have to master. It's a completely different. I sometimes, since provider, struggle with the cannula because they treat it as a needle. They think it's a really sturdy cannula, and as you turn, it will turn with it, but it's not. It's a flexible tube. The same thing goes for threads, and with the threads, there's no room for error. So people who I know who are successful with threads, they've done trainings after trainings after trainings. And I can tell you that now, me doing threads for 9 years, I'm at the point, but I think that's kind of like that with a lot of aesthetic procedure, where I'm at the point that I know enough that at the point of trying to learn such a nuances that I haven't even thought about them 5 years ago, because I wasn't really, my mind wasn't in the position that I can actually think about it or ask question about it. So I do tell people I don't train on threads like I would do on the filler, because I don't think 4 hours, 3 hours is enough for you to master it. However, I am considering maybe doing trainings like a day or 2 days, to the point where you can teach how not to do harm, maybe not get a fantastic outcome, but it's enough knowledge to you perceive that learning curve without being disappointed, without disappointing the patients and harming them.
Gotcha. Well, very interesting. Thank you for touching on threads. I think that's great. I don't have any experience with them. Since I'm pretty new, I want to kind of hone my skills in on a few things versus kind of spreading myself too thin. But I do want to ask you, because I know that you do inject some higher risk areas, and I want to chat with you about, you've obviously been doing this 20 plus years. You have immense knowledge really on a lot of aesthetics, it sounds like. So I guess kind of when treating high risk areas, is it something that you've always done? So you kind of go on almost autopilot to where you know kind of the risk versus benefit and you're able to navigate that safely? Or every time you go into a high risk area, are you just a little nervous?
Well, when I started, I look back and I do believe God was watching over me, because I think back what I used to do and I'm thinking, how on earth did I not get in troubles? But then when you don't get that free pass anymore. I think you hold responsible for every decision that you make. Again, back then, I must tell you, before I started injecting Piriform, I was injecting for 7 years before I actually injected the Piriform.
Okay.
I'm not saying that it should take you that much now, because I just didn't have enough resources for someone to actually teach me. And that's when I actually found someone who taught me that I felt comfortable start doing it. However, I still hold my breath every time I inject Piriform. And I think there's a slogan that people use for Botox. It's like precision, patient satisfaction, and predictability. I have my own 3 Ps when I'm actually injecting someone. It's poke, pray, pucker.
Oh my gosh, love it.
But I definitely assess risk versus benefit. And what I mean by that, well, patient selection is the must, because every single person who comes in through my office, they know about every single complication that could possibly happen in a different area of the face. And I also want to make sure that I have a relationship with the patient that I know will first do what I tell them to do. Second has a common sense. Third is something like that happened. They truly understand that risk, because not every patient does. They don't read consent form. And even if they say, okay, I got it, they really don't get it. So for me, that's very important. When people ask me who I would do nose job on, non-surgical nose job, my answer is someone who I'm willing to give my cell phone to. And I can give them my home address. That's how common sensey person I wanted to be. But then in the same time, say I have someone, I treat a lot of Bell's palsy patients, and then I treat a lot of patients who had some deformity that they're born with. So if I look at the patient and I know I can make significant difference, even though it's a high risk area, after having that discussion, and I do go by my gut feeling too. Like if I have a gut feeling I shouldn't be doing something, I won't. But after having a discussion, I would proceed with that treatment. But say if I have a patient who is 18 years old and their nose is as perfect as it could be, it could be like 9.6. And maybe I just be able to take her to 9.7. That is not a risk that I'm willing to take, because the risk versus benefit ratio does not align. And then that's when it comes in for me educating that patient and talking her out in some sense, because unfortunately social media and just any other platform has this effect on the young generation that they start not recognizing their own beauty and start feeling down about themselves. And a lot of times it's a lot of hand holding and a lot of praising and lots of just affirmation for them, how beautiful they are and what they should be thinking about and and that's just, and I'm okay when patient comes in, and if I don't think it's the best procedure for them, I'm okay not to do a treatment, because in the end of the day, I want to make sure that whatever I've done for them, I would have done it to my own sister.
I think that's a great point. You did mention like going over consents and the fact that patients don't often read them. So I think that for the listeners, I think it would be good if you could actually run through maybe some of your verbiage that you go through when you talk about the worst case scenario when you're treating them. Like, how do you really approach full transparency and kind of the risks that they're taking on?
Mm-hmm. Well, you know, the one thing that I don't necessarily love about our industry, that a lot of times this is because it's fun and it's quick and it's a lunchtime procedure. People don't perceive us as a real medicine.
Right.
They think it's like getting a hairstyle for them to come in and get a filler done. And I was guilty of that in the very beginning, because you didn't know what you don't know.
Right.
When patient comes in fact, I had a patient today who came in who's been getting filler done for the last 10 years. She moved here from different state, and before we proceeded with her, because we were doing her piriform support, her chin, her lip, I basically just said, I know you've had a filler done before, so probably none of this will come as a surprise. But after I collected her medical history, but there's a few things that I want you to bring to your attention, and I want to talk to you about it. And believe it or not, she never heard of what vascular occlusion is.
It's crazy.
And it carries certain risk, and I will do everything possible in my power to avoid those risks, but it still happens. You can, since filler is a gel-based substance, it can get into a blood vessel and it can block the blood flow that carries the oxygen to a certain part of the skin. It's only an issue if it's not recognized or resolved. I give them my personal example. In 23 years, I've had 2 vascular occlusion that were very successfully resolved. I look back and I do not know what I did wrong, why it happened. It did take for the patient to stay a little bit longer in the office. She had to cancel her hair appointment. We resolved what it needed to be resolved. She went home, and then she came back a couple weeks later, and we re-injected it, and it was fine. I do go down, if we're going down to the bone, it's a vascular area in most of the places. Piriform aperture is considered to be one of the highest risk area, but you need to tell me if you're gonna, when I inject piriform aperture, I usually tell them you should feel the pinch going through the skin, but when I'm in a spot on the bone, it should not be uncomfortable. If it's uncomfortable, let me know. Hold really still. My needle doesn't move. I aspirate longer in that particular spot that I would maybe in the cheek. I don't prime my needle. My bevel turned towards the nose, away from the angular artery. I inject extremely slow. I look for surrounding tissue. I look for the feedback from the patients. Now, there's certain things that patient needs to be aware when they do a dermal filler that is not happening right away. It may not even be happening when we do follow-up calls. It can happen months from now, and it's an immune response to the filler. And even though it's a very, very small percentage, it's very tiny, I can't remember from the top of my head, but if someone, say, gets a pink eye or a UTI or they get a flu, their body starts rattling up and they start attacking filler. And patients will get little swelling, little tenderness, but they don't necessarily relate it to the filler if that would happen 7 months from their procedures. And all it takes at that moment is just to take some antihistamine and call our office. And if they get the antihistamine on board, we don't have to do anything else after that. My assistant, who had a second COVID vaccine, her filler swelled up that it was done 9 months ago. And it was like chin was swelled up on one side, the cheek was swelled up on the other side. She took Benadryl at night and Claritin in the morning, and it went away. But if we don't educate the patient, and that happens because there's so many different factors, this industry is so new, we don't know what actually causes it. And sometimes we never would, and we just need to treat the symptoms. But if the moon affects the ocean, I'm sure so many things that can affect the human body, and you need to prep the patients for them to not to be worried, and also accept those risks because it's not anything that you do, it's outside of your hand. And again, they need to be responsible of remembering, following your instruction, and staying in touch with you for that particular reason. And then I usually, and depends on this area. So say if I am filling in glabellar lines with the filler, I do have a conversation that's the area that is closest way to your eyeball, and there's a report of causing blindness. Now, injections in the nose that caused the blindness was actually done with the cannula, large cannula. Not necessarily a needle, but I also have an ultrasound in my office too. So some of the areas, like when I would do a temples, and if I am planning on going down to the bone, I would pre-scan the patient to see where that deep vein is and if I'm safe to inject it or not. So that gives me a little bit of a peace of mind, but still, my patients assume the risk. And if someone is not, if I see the patient who is not comfortable with those risks, I would encourage them not to proceed with the procedure because it's a selective procedure. Should make someone feel good about themselves. And it's not worth it of the worry and causing a stress if they're not ready to go that route.
Thank you for covering all of that. I think that you laid it out really great to where you're explaining everything, but you're not using any type of scare tactic, but you're really putting it back on them, saying, hey, these are the risks, and are you willing to accept those? I think that more injectors definitely get a little nervous about talking risk because they think that it might scare the patient away from doing treatment, but I think it's really important to cover those.
Yes. And, give them an example. Like when I tell patients, I do this every single day for 23 years and it happened twice, then it gives them a little peace of mind. But it's not even that. You need to talk about the complication or sometimes undesirable outcome, because that's what helps you build those relationships. Because if things doesn't turn out the way how we're hoping for, it doesn't happen very often, but sometimes it does. If you haven't covered that with the patient, your patient's gonna be either embarrassed, don't want to bother you, or don't have a faith in you to come back for you to be able, for me, first of all, learn it, what happens, and for the patient to feel comfortable for them to come back and say, hey, is this how it's supposed to be? Or is there something that could be done? Because I see people jumping around for that particular reason. If no matter what you say to the patient, if you said it before procedure, it gets perceived as a consent. If you say it afterwards, patient perceive that as an excuse. And you don't want to put yourself in a position, because even if you tell the patient, it's normal if there's a little bit of a bruising for you to look uneven, then they're like, okay, she said that. But if they look in the morning and they look uneven and you haven't warned them and patient calls you back, then they'll be like, well, she's just saying that it's normal because she probably did something wrong. And yes, it will even out, but it will be unease for the patient for a couple of weeks and unease for the provider, because they see this hesitation and nervousness of the patient that they have to deal with for 2 weeks, which could have been avoided.
What a great point. So you've already given us such great advice, and you've really talked us through a lot of really all my questions. I don't want to keep you too much longer, so I want you to give any advice that you have for the new injector, current injector, anything that you want to leave our listeners off with.
A few things, just because it's a trend in our industry about, there's a lot of key opinion leaders out there that state their opinion as a fact. And a lot of newer injectors, they don't have enough knowledge to sift it through. So they hear someone say something, or they read an article and they're like, okay, this is how it is. There's no white and black in medicine, period. And you, as an injector, say you're reading an article, learn how to read that article. If there was a 10 subject in that article that states something, you have to look at that as a good to know, because how is that 10 subject relate for the rest of the world, like different ethnicity, different gender, different age. You need to look at something as good to know and then be willing to be able to change that opinion. I can tell you that there's a certain things that I will never do now that I did 10 years ago. But if I would be stuck in my own way, I would have never learned. And I've gone through that curve where it takes for you to know enough for you to realize how little you know. I probably was injecting for like 12 years when I felt like, okay, I think I got it. And then when I was injecting for 20 years, I was just like, I don't know anything. There's so much more to learn. And treat this seriously. This is not a side job. If you're going to go into this industry, I spend more money on education now than I did when I was first started injecting, because again, I didn't know what I didn't know. And it's constantly evolving. Be willing to learn, be willing to ask a question. Like I tell people when I train them, if I'm telling you to do something, I have my reasoning behind it. Now, it may be a wrong reason, but in my head, it makes sense. I can tell you why I am having you hold the syringe in a certain way, why I want you to have this angle, why I'm having you poke in this particular spot. Because you're always 1 millimeter away from total success or to total failure. And then you learn something and you're like, okay, well, I've tried this and this is work too. So ask question why. Don't just take someone's word as a gospel. It has to make sense to you as an injector, because in the end of the day, if you would run into complication, you need to make sure first you didn't cut any corners and you knew you did that treatment to the best of your knowledge, skill, and safety. And then even if you have a problem, you're still going to be able to pick up a syringe and do another treatment.
I think that's great advice. I think that it says a lot. It shows that you're very, very humble and very knowledgeable for you to say, you said like 12 years in, you felt like, okay, I got this. And then 20 years in, you're like, I know nothing. I think that's a very powerful statement. So amazing advice. Where can we find you at your clinic as well as on social media?
So my social media is just my name, which is not that easy, but Ina Prokopenko _RN. And my office website is Viso SLC.
And that is a wrap on season 3. Thank you again for continuing to listen to my journey, all the professionals that are willing to take the time to listen to me as well. Again, giving me this platform and allowing me to provide content to aspiring, current, new injectors. It's something I'm very passionate about and love doing. Again, thank you, Ina, for taking the time to record with me. None of these guests are paid. They take time out of their day to share their knowledge with you all. So again, I just so appreciate every guest and every listener. You know where to find us on Instagram. We are at aesthetic.chatwithkiki. My Instagram is at aestheticnurse.kiki. The website is aestheticnursekiki.com. And lastly, if you're looking for my new clinic, it is called Natural Aesthetic and Wellness, and the website is naturalaestheticandwellness.com. We are located in Coeur d'Alene, Idaho, so definitely check us out. Have an amazing rest of the year, and you will hear from me in 2024. Bye, beauties.